Hello, hi, welcome everybody to our chat with our midwife session. So today I have with me two of our Columbia Asia Petaling Jaya midwives, Aina and Siuman. They are here to share with us what they do on their daily work in the labor room. Okay, so without further ado, let them introduce themselves to all of you. Okay.
Hi, good day everybody. Okay, my name is Aina. Okay, I'm a degree holder, nurses, and then currently I'm doing my master. Hopefully will be finished lah, this end of this year. And then years of experience, total in nursing is 7 years.
Okay. Siuman?
Yeah. Okay. Hello everyone. My name is Siuman. I've been midwife for maybe 7 years, total in nursing 9 years, all especially in labor ward care. So yeah, I've been working with Columbia Asia PJ for a few years right now. Yeah.
Okay, thanks Aina and Siuman. Okay, so what we are going to share with our viewer today for our webinar is that what you actually do in labor room or even in the ward while caring for pregnant moms in labor. Okay, so Aina, if you don't mind, we'll start with you. Okay, since you're next to me. How do you care for moms who are in early labor? Let's say they are in the ward. They haven't even come into labor ward yet. They are just in the ward. They're just starting off their labor. How would you monitor them? How would you care for them?
Okay. First of all, is the patient in the ward. As a midwife, we will see the patient and we do the monitoring. We call the CTG, cardiotocograph. So we will be monitor the contraction and then the fetal well-being also. And then we also will reassure to the patient, and then we will offer the painkiller to the patient if they need it.
Okay. And how would you know when to transfer the mom into labor room based on your experience?
Okay. Based on my experience, if the mother will having the contraction is increased, or maybe they need we call the enteroc gas, painkiller as a painkiller. So we bring her to the labor room, and also if they're ready to give birth, then we bring the mother straight away to the labor room.
Okay, basically if they want to give birth, that would be really
it's
like
really
a rush.
urgent.
Like everybody have to help to push the mom in.
Yeah.
Okay. Very good. So have you actually experienced birth or a near birth in the ward?
Yes. Seriously, yes. I have it, but it's really like very emergency time. Like we need to push very fast the patient to the labor room.
Okay. Glad that you're there to take care of the moms.
Yeah.
Okay, so as for Siuman, okay, since you have like almost 7 years of experience in labor room, so once in labor room, how would you care for the mom? What do you need to watch out for? What do you need to do? How would you basically manage a mom in active labor, if you don't mind sharing with us?
So when mother comes in here, when they're in active labor, that means established already. So midwife will be monitoring baby heartbeat every 30 minutely, and then we will time for any contractions, which some people refer it to surge. So we'll be monitoring very frequently so that we know that how's the labor going on. When it's getting more contractions, like very frequent every 2-3 minutely, of course we're coming more often to you. If you're not in really established labor, for example, it's like too early, we won't disturb you so much. We'll let you have your own space with your spouse in the room, let you have some personal space lah. So basically intermittent monitoring through the CTG that Aina spoken just now, every half an hourly fetal heart rate monitoring and timing of contractions.
Okay. now that you have mentioned some of the mums, they prefer their privacy while they're in labor. Of course, it's a very private matter, isn't it? They would prefer to spend it with their spouse. Okay, we have heard that some mums, they prefer some gentle birthing, okay, without much interruption and interference from the medical staffs. So have you actually experienced couples as such, and what are your, let's say, experience in that? How would you help them if they wish for a gentle birth?
So regarding gentle birth, it happens that our hospital, Columbia Asia PJ, is like very well known for the gentle birth. We really promote gentle births. So usually when patient coming in to visit us, I will always tell them you can always bring your own diffuser so that you have like very nice feeling aroma in your room so that you feel better. Yes, and then you can always bring your own gym ball. If you don't have it, we always have ready gym ball for you, our yoga mat. And also you can open up your you can bring any electronic devices here. You can open up any music, just anything you can do here, we just support you. So regarding giving you a privacy also, yeah.
And what about like if they prefer a more cozy environment, like dimming the lights?
Yeah.
How I mean, are they able to do so?
Yeah. So in our rooms, we have a few lights we can choose, but we have a special light which is just underneath the down light, which is very dim light. So all mothers can be here. We just dim the light for mothers so they can sleep, they can rest in an ambient environment. So it's rather than very bright light, very glaring. And also when baby will be born at that time, you also can dim the light as you wish.
Okay. What about if, let's say, the mom wish to eat and drink? Are you all able to?
Yes. In our labor ward, we do not really restrict mother. We encourage mothers to drink a lot of water, plenty of water, so that your labor gets progressing. Don't dehydrate yourself. We always ask you to drink, and eat anything that you want. You can bring any home food here, any snacks, tidbits or anything, just bring over. We never limit. In fact, we encourage you to eat as much, drink as much, and also moving around.
Yes. Okay. All right. Okay. So, how would you, let's say, know when to call for your doctor to come in? Well, you know, if not, then you have to be conducting the delivery already if you call it too late and all. So what are the signs that you look out for, basically?
Okay. I think most patients, they were afraid that doctor is like couldn't be here at that time, at that very moment, but
I live next door, so
but okay, so as I told y'all earlier, we will monitor you every half an hour, and depends on how frequent, how strong is your contraction, you will come in more often. So if we see signs that you're really in real active labor, we'll see the signs is like very late stage already. We see a lot of bleeding coming out, we have a lot of show, and we see you're like pushing indirectly yourself. We know the certain signs. We will do a vaginal examinations so we can assess your labor. When we know how descent of your baby and how much dilatation of your baby, the cervix, then we will call doctor to come here, of course.
Oh,
yeah.
You have to run after that.
Yeah.
Okay. So let's say doctor's here, birth done. Okay, so right after the birth of the baby, usually what we'll do is that we'll place the baby on the mom's chest for skin to skin bonding. So how are you able to assist the mom in that?
Okay, so right before baby is born, before we already help you to like lift up your loosen your gown a bit, so that straight away baby can crawl on you. So right baby, after it's born, baby will pull directly on your skin, so baby will be skin to skin with mommy before umbilical cord is clamped or
That
cut.
meaning we cover the baby
Yes.
with the flannel.
Yes,
and
so
gown, yeah.
baby with mother skin to skin, then only we put on another baby wrapper on top it, so prevent baby
Baby getting cold.
yes get cold. So and then we will guide you. Okay, the first thing most important is skin to skin. Maybe breastfeeding will be a little bit late, maybe after stitching, because actually the first moment is baby need to smell mommy's body first. Let baby
Listen to
get
the heartbeat of the
yes,
mom,
let
yeah.
baby get used to you first and listen to your heartbeat rather than straight away catching
Because
your breast.
sometimes a baby, they don't really want to breastfeed. You force the baby
Yes.
to the breast. Baby may just get
Yes.
cranky.
Yes, because not all baby born straight away they will latch on you. Baby needs some time, so actually is please don't distress yourself straight away to have breastfeeding. You can always bond with your baby first, skin to skin first.
Okay. Okay, Aina. Let's say after everything's done, after the birth of the baby, we are transferring the mum back to the normal ward. Okay, so obviously we will still need to monitor mum when they're there before they get discharged. Likely the following day. So in the postpartum period, the postnatal period, how do you care for the mum?
Okay. After the delivery, everything, the mother's stable in the labor room, then we transfer to the normal ward. After that, within the 6 hours, the midwife will check on the patient, and then we'll do the assessment on the patient to check the uterus, whether it's well contracted or not, and then we must to make sure patient pass urine so that they didn't hold the bladder. So
Overextend,
yes,
yeah,
so
yeah.
will affect the uterus to contract well. And then next we will monitor the blood pressure, temperature, just to make sure in the normal range lah.
Yeah. Let's say if the mum were to bleed a lot right after the birthing of the baby, how would you manage such mum?
Okay, first of all, as the first step, we need to massage the uterus to make sure it's well contracted. If still not bleeding, we need to call the doctor lah for sure. Whether the doctor want to give
Additional
medication, yes,
Yep.
for the patient.
Alright. Thank you so much for that. Okay, so definitely you would like to hear next what are their most memorable, okay, let's say case or mother while the mothers birth their baby. Probably they would love to share with us, okay, viewers, on their most memorable experience in labor room. Aina?
Okay. Actually, throughout my experience, all the delivery is most memorable for me. One case that I cannot forget is like first time I saw delivery with the baby still in the sack halfway. Okay, that's the most for me. And then what else? That one lah, I think is really interesting.
So it's like encore, they got almost like encore birth.
Yes, I mean like first time I saw throughout my experience as a midwife, I feel like that one is really, I cannot forget that time.
Well, it's not. It's quite rare. You don't really see it.
That's why I was like, oh,
in fact,
okay.
in my career also, I think I've seen it once or twice only. Was it with me?
Yeah, with you. I like, oh, okay.
Okay. Alright. What about Suman?
Okay, actually all labors is like very special, but one that I really like have like impact, not impact, like most memorable is of course I don't remember which patient and what is the weight of the baby. It's like a patient need to push for a very long time, more than 1 hour. So she is very exhausted. So what we did in labor ward is everybody go into the room. I think there is around 4 to 5 staffing of labor ward just went into the room and pushing together with mother. We are like cheerleaders for the mother, and the patient husband is also pushing together with us. We all like cheering. It's like when you're going to see the football match, everybody is cheering. Then finally baby out, and both couple is very happy. They are crying, and then suddenly baby's father is like singing
Phrases.
singing like baby's song.
Lullabies.
Yeah, lullabies for the baby, so it's like very touching. Yeah, just that.
Both are very warm, touching experiences in your career. Okay, so thank you so much for spending time with us, sharing with our viewers. So once again, thank you so much, Aina. Thank you so much, Siuman. And if you guys are coming in to birth with us in Columbia Asia PJ, you'll be seeing these two angels. All right. So thank you so much. Thank you. Bye bye.